Thank you very much, Representative King-Hines. The chair now recognizes Dr. Conaway for 5 minutes for any questions you may have.
Thank you, Madam Chair, and thank you, ladies, for your service and your commitment to veterans and their health care. I want to make a few comments and observations since both sitting on this committee and what I've heard today. I hope there is consensus on this committee and across the House, across the government, that we need to have a strong VA healthcare system and that we need community providers, because we know the VA doesn't exist everywhere, particularly in rural areas. And so we know that this partnership needs to exist. One of the problems, as a physician, practicing physician for 30 years myself, worked on an Air Force base in New Jersey taking care of veterans and in the community and private practice. What my experience tells me, and what I have read about, and what the research shows, and what we all know with the problems with our information system, is that there's not coordination across those systems. Once you move outside of a system, even within hospitals in my own little state of New Jersey, getting records to move from hospital to hospital, if they're not on the same platform, is a very difficult thing to achieve. And you will have, and so you're going to have patients, if they move to different locales, having to repeat their stories, and it's terrible when it involves things like trauma. When you're in a teaching institution, your resident might see you, might be a medical student, then a resident, then the attending. And so this is part of the teaching process in teaching institutions, and unfortunately, we will hear stories about people being re-traumatized as this information is collected. But that iterative process in teaching institutions is part of driving great outcomes. I would also say that we have to rely on data, as you mentioned, and the data has been consistent over many years and repeated that VA care for veterans provides great outcomes. Veterans want care there. And if you think a moment about the different exposures, the experience in the military where they have been, the experience of people taking care of numbers of veterans over years that is unlikely to be replicated in most communities, it doesn't surprise me that outcomes are better than the VA system. Our problem is that it's hard, maybe I should speak for myself, but I think I'm speaking for a lot of others too, when we understand that the administration is cutting tens of thousands of people out of a system that's already stressed. It's hard to imagine that you can achieve the kind of outcome standards that you could achieve if those people weren't out of the system. Now, reform, looking at how things are done, making sure training is correct, maybe having a special access for women who are having particular problems, whether it be reproductive health care or sexual trauma in the service, those things are important to put in a system. I think you're more likely to get that in the VA than very often you're in the community, by the way, because of the sensitivities in the VA system for this. I suspect, and as I look at the numbers we have about the people who have been, who are leaving the service now, as I look at the numbers, 2/3 of them are clinical staff, physicians, nurses, support staff. And so if we were to decide to bring in or try to recruit more women to deal with sexual trauma in the service, I can't imagine how that wouldn't be decried as a DEI program within the government. You can't even recognize women who've served, honorably overseas because it's, recognizing women, and never mind people of color. So I want to ask this question of you, Ms. Newman, because you work in a rural area, and we know now that there are a number of studies that are coming out showing that these Medicaid cuts are going to be particularly devastating in rural areas where Medicaid might make up 40 to 50% of the revenue. We heard 338 hospitals at risk. You live, and others on this panel live and get care in rural areas. Can you describe how the loss of hospitals in the community is going to impact access to care, the access that we know veterans need?
Thank you for the question. Yes, I do live in a rural area. In my particular area, we already have lost access to hospitals. We are an independent home care agency, and these cuts are not going to, in particular, impact our agency. But our people in our area, they're already used to traveling to receive care.
Just reclaiming my time because I'm running out of time. And thank you for that. I think it is it's obvious that if hospitals close, there's going to be an access to care problem. I asked Secretary Collins at a hearing just like this one about whether or not cuts to Medicare and food assistance is going to impact veterans. He says, I don't foresee that happening. Now, well, now it's happened. And we know, as a result of that big ugly bill, that we're going to see really quite devastating dislocation across the land, and particularly in rural areas, and also impacting veterans, and that's a shame, given the commitment this country needs to keep to our veteran community. Thank you, Madam Chair. I yield back.
Thank you, Dr.